What's up, guys? Hey, Jared Beckstrand here, Doctor of Physical Therapy, ToneAndTighten.com. The solution to getting a stronger lower back at home might be a little different than what you're currently thinking. Let me break it down for you. Let me do it right now. Lower back pain is one of the most common conditions that I treat as a physical therapist. Now, it's important to note that lower back pain is a symptom and not a diagnosis. Lower back pain simply describes, yes, I'm experiencing pain in my lower back, but it doesn't tell me anything about the reason why that pain is there. If you find a really good physical therapist, he or she will not only address the symptoms and help you with your pain, but also identify that underlying cause and be able to help you out of that pain in the future by prescribing the right exercises to prevent that pain from coming back. That's my goal with today's video. Now, in order to present these exercises to you, I need to make clear one more very important distinction, and that is the difference between mobility and stability. When we think about mobility in the core, we need to think about the hips. They are the big, strong mover of our core. When we think about stability in our core, that's where the lower back comes in. Your lower back should be a very stable structure, while your hips are a very mobile structure in order for things to work normally. Pain can start to occur when those areas aren't performing their function as they normally should. If your hips are weak or if your hips aren't mobile enough, they'll start to call on your lower back muscles for that mobility and for that strength. Suddenly, your lower back has to perform these activities and these functions that it's not necessarily equipped to do, and that's where the breakdown occurs. So any good lumbar and core stabilization program must include some form of hip strengthening as well. Those are the exercises that I hope to show you today. These exercises and this treatment typically works best for what we would call mechanical lower back pain, pain that comes on gradually over time, progressively worsens, very localized into your lower back. If you have any radicular symptoms or nerve pain, disc pain, shooting, numbness, tingling, things of that nature, these might not be the best exercises for you, and so keep that in mind before you jump into this video. I'm also going to present these in an order of simplest to most difficult, least aggressive to most aggressive, so hopefully something along this continuum helps you guys out of some of the pain that you're experiencing. Okay, that's enough from me. Let's get to work. My first go-to exercise in strengthening your lower back is always going to be bridges. I literally give this to 9 out of 10 low back pain patients that come into my clinic because it's such a great and effective and relatively easy exercise. You can do it anywhere, no equipment. Lay down on your back with your knees bent. You're going to start by pushing your heels into the ground. Now I want you to contract your glutes. So squeeze your butt together. That is where we want to initiate this movement. Heels down, glutes contracted, and then use those glutes, push through your butt to lift your hips up towards the ceiling. I'm going to keep that nice tight contraction up at the top of this bridge. I'm going to hold that for a 3 to 5 second count, again promoting stability in this contracted position, and then I'm going to slowly lower right back down. Dig in with the heels, squeeze the glutes, up we go, hold that glute contraction, 2, 3, 4, and 5, and then come back down nice and slow. Shoot for a set of 10. If 10 feels good, we'll do 3 sets of 10. A good progression would be up to 3 sets of 15. To take these bridges to the next level, exercise number 2 is going to be a bridge with a kick out. The same principles apply. Heels down, contract the glutes. We're going to come up into this bridge position, but now what we're going to do is slowly extend one leg and then come right back down. Slowly extend the other leg and then come right back down, and now return to that starting position. The key here is your pelvis needs to stay nice and flat the whole time. Squeeze the glutes, lift the hips. As I extend this left leg out, this left hip is going to want to drop down towards the ground because I've eliminated its base of support. My right hip has to fire even harder to keep that pelvis raised up towards the ceiling, up nice and flat. The left hip should stay as flat as that right hip throughout that motion. We come back down, and then we're going to extend the other one out as well. And so real time, come up, extend left, extend right, and then come right back down. That would be 1 rep. Again, you're going to shoot for 10 reps. You're going to shoot for 3 sets of 10 and progress from there. Next up, let's talk about squats. I would literally be shunned from the Physical Therapy Society if I made a video about lower back stabilization and hip strengthening and did not include a squat exercise. It's so great, it's so functional. We do it all the time. It's a motion that we need to be performing, and we need to do it the right way in order to avoid low back pain. Feet are about shoulder width apart. The first motion that I want to do is actually hips backwards. Introduce what we call this anterior pelvic tilt. What that's going to do is promote motion at your hips, but then promote that nice stable spine. There is a slight round to my lower back, and I want you to maintain that throughout the entire squat activity. Hips go back first. I'm going to hinge at my hips. My back is going to stay straight until I start to lose that curve. Go down just as low as you can. And now, here's the key to this. When we initiate that motion, you can do that in your quads and in your legs, but I want you to fire the butt first. Hips first, we get down into this back position, this low squat position, fire the glutes, and then squeeze the glutes throughout that whole motion. And so we're getting a good hip extension, we're getting good glute activation, while the back is staying nice and neutral. Go down just as low as you can, even if it's just like a quarter squat or a half squat, that's totally just fine. Then use those glutes to initiate that return to upright position. Shoot for a set of 10. 10 feels good, do 3 sets of 10. Next, let's talk about some lumbar glute pulses. Sometimes you'll also refer to these as pulsing eyes. What you're gonna do is lay down on your stomach with your arms at your side. First move is to lift your chest up off the ground. Note that it doesn't have to be a very big motion, and that really that motion occurs in your thoracic spine, meaning your lower back, your lumbar spine stays relatively neutral. That motion comes from my upper back primarily, but my lower back has to be stable in order for that motion to occur. So we get that stability in your lower back. Now what we're gonna do is fire the glutes and lift that whole leg up off of the floor. You'll see that it's not just my toes, it's not just a hamstring curl, but that my knees actually come up off the floor. If my knees come up off the floor, I know that motion is occurring in my hips. I know that the strength and the power for that motion is coming from my glutes. And so again, in real time, we're gonna come up with the chest, and then we're gonna come up with the knees, and then come right back down. Now, the pulses can come from 2 places. Up with the chest, up with the knees, and then I'm gonna hold that while I pulse with my arms. 1, 2, 3, 4, 5, and then come right back down. That would be the, I don't know, beginner version of this, the not as hard, the easier version of this. If you want more of a challenge, up with the chest, up with the knees, and now let's introduce those pulses in the butt. 2, 3, 4, 5. So now it's my glutes that are lifting my legs and pulsing with my legs. And so that 5 pulse count would be 1 repetition. So again, up here, 1, 2, 3, 4, 5, and then come right back down. I would shoot for 10 of those. If 10 feels good, we're gonna work our way into 3 sets of 10 of those pulses. Our final exercise is probably my personal favorite. This is going to be a reverse glute extension. I'm going to be showing you on my bench. Now, if you don't have a bench available to you, you can do these on your bed, on your couch. I've even had patients go so far as to do them on their kitchen table. All are great options. Now, first things first, we're going to get into this position right here. So you'll see that my torso is supported. My lower back is also supported. If you're down here too low, that's going to cause your lower back to round. That's going to increase motion in your lower back. Not the goal of this exercise. Stability in our lower back, mobility in our hips, that's what we're after. So I'm going to slide back to where I need to be. Hips are gently supported, lower back is definitely supported. In this position, we're going to go from a position of hip flexion, meaning with my knees bent, to hip extension, meaning I'm going to pull my knees up and back behind me. Fires the hamstrings, fires the glutes, but our lower back is definitely stable while we're performing that lift. So it looks just like that. Hold at the top for a 1 to 2 second count, and then lower right back down. And you guys, this lights up those muscles immediately. You'll feel those glutes fire. You'll definitely feel those lower back muscles as they try to stabilize. We're keeping the spine in a very flat, very neutral position. We're not going into aggressive extension with this, making it a fairly safe exercise for most conditions. That's hard to do while you're laying on your stomach. And so, just like in the other exercises that I've demonstrated in this video, you're gonna go for a set of 10. 10 feels good. Shoot for 3 sets of 10. There you have it, you guys. 5 of my favorite home exercises to strengthen your lower back. Keep in mind, it's not all about strengthening your lower back. We want to stabilize your lower back. We want to strengthen your hips and hopefully help you out of some of the pain that you might be experiencing. Hey, I hope you guys enjoyed this video. If you do me a favor, hit that thumbs up button. I would also love to see you here more regularly. If you haven't done so already, I'd love for you to subscribe to Tone and Tighten here on YouTube. You can do that at this circle button right here. If you're looking for more great exercises and rehab tips for your lower back pain, here's 2 videos that you will definitely benefit from. And I hope to see you again soon right here on Tone and Tighten.